Hi friends, today we are going to learn the osteology of scapula. So here I am having the scapula with me. Let us see what are the parts of the scapula. The scapula, if you see, it is having a triangular body. This is the triangular part, and it has got some processes are there. So here you can see this is the spinous process of scapula. This is the acromion process of the scapula, and here we have the coracoid process of the scapula. So it has got three process: spinous process, acromion process, and coracoid process. Okay, and you can see it has got three borders: superior border, medial border, and lateral border, and three angles are there. So we have the superior angle, lateral angle, and inferior angle. How to identify the side of the scapula? Okay, so first hold the bone and examine the angles. Three angles are there. I told you: superior angle, lateral angle, inferior angle. If we see the lateral angle of the scapula is modified to form an articular facet. This is known as the glenoid cavity or the glenoid fossa. So we have the glenoid cavity. The glenoid cavity is directed laterally, and the spinous process of the scapula, which is present on the dorsal surface of the scapula. Scapula has got two surfaces: dorsal surface, which is directed backwards, and ventral surface, which is directed forwards. Okay, and we have inferior angle. Inferior angle is directed inferiorly. So these are the points to be noted. First, I search for the glenoid cavity, which is directed laterally. Then the spinous process is present on the dorsal aspect. Then the inferior angle is directed inferiorly. So this bone is the left bone. Now let us see the detailed features of the scapula. The scapula has got two surfaces. There is a dorsal surface, and this is the ventral surface of the scapula. Okay, and the ventral surface of the scapula is known as the subscapular fossa, because the major part of the subscapular fossa or this area gives attachment to origin to subscapularis muscle. Subscapularis muscle. Here we have the ventral surface or the costal surface. If we clearly examine the costal surface, we can see some ridges over here. Okay, so you can see some ridges. There are three longitudinal ridges. These three longitudinal ridges gives attachment to the intracapsular tendon of the subscapularis muscle. So this area gives origin to subscapularis muscle, and we have three ridges over here. These three ridges gives attachment to the intracapsular tendon of subscapularis muscle. And near the glenoid cavity, there is a bursa deep to the subscapularis muscle, and this bursa is known as the subscapular bursa. Subscapular bursa. Now let us see the dorsal surface of the scapula. So if we see the dorsal surface of the scapula, which is convex, and we have a spinous process. This spinous process divides the dorsal surface into two areas. Area above the spinous process is a supraspinous fossa, and area below is the infraspinous fossa. And these two fossas are communicated here. You can see there is a communication where the supraspinous fossa is communicated inferiorly with the infraspinous fossa, and this cavity is present between the glenoid cavity and the spinous process. So the cavity is known as the spinoglenoid notch. So here we have the spinoglenoid notch. Spinoglenoid notch connects the supraspinous fossa and infraspinous fossa, or the supraspinous fossa is communicated with the infraspinous fossa through the spinoglenoid notch. Spinoglenoid notch here. The supraspinous fossa gives origin to a muscle that is known as a supraspinatus, and medial two-third of the infraspinous fossa gives origin to infraspinatus muscle. So we have the supraspinatus muscle over here, and this here we have infraspinatus muscle. Upper two-third of the dorsal surface of the lateral border gives origin to teres minor, and the lower one-third gives origin to teres major. A small area near the inferior angle, some fibers of latissimus dorsi takes origin from here. Okay, so this is the coracoid process. Near the root of the coracoid process, superior border presents a depression or a notch. It is known as the suprascapular notch, And during living condition, the suprascapular notch is bridged by suprascapular ligament and convert this notch into suprascapular foramen. Suprascapular artery passes above the ligament and suprascapular nerve passes below the ligament. So remember this one, we say army above and navy below. Army for artery and navy N for nerve. Suprascapular artery passes above the suprascapular ligament and suprascapular nerve is passes below the suprascapular ligament. Near the suprascapular notch, the superior border gives origin to inferior belly of omohyoid muscle. Let us see the lateral border. If we feel, you can see lateral border is thicker than the medial border. Lateral border is thicker than the medial border. Here we have the glenoid cavity, So glenoid cavity has got a tubercle above. This one supraglenoid tubercle. The same way here we have infraglenoid tubercle. Supraglenoid tubercle gives origin to long head of biceps and infraglenoid tubercle gives origin to long head of triceps. The medial border extends from the superior angle to the inferior angle. And if you see the costal surface of the medial border, the whole of the medial border on the costal surface gives insertion to a muscle, that is the serratus anterior muscle. Serratus anterior muscle is supplied by long thoracic nerve. Injury to the long thoracic nerve leads to the paralysis of the serratus anterior muscles and results in a condition known as the winging of scapula, where the medial border of the scapula is elevated. That condition is known as the winging of scapula. On the dorsal aspect, the medial border of the scapula gives attachment to some muscles. Just opposite to the root of spine, this is a spine, just opposite to the root of the spine, so we have a muscle is inserted called rhomboides minor. Rhomboides minor, and below rhomboides major muscle is inserted, and above this area gives insertion to levator scapulae. Now let us see the details of the spinous process. So now spinous process is attached on the dorsal aspect of scapula, which divides the dorsal surface into supraspinous fossa and infraspinous fossa. The spine has got two surfaces. The spine has got two surfaces. There is a superior surface and inferior surface, and it has got three borders. There is an anterior border, posterior border, lateral border. Anterior border is fused with the dorsal surface of scapula and the posterior border is prominent. Okay, that prominent posterior border is known as the crest of spinoscapula, and the lateral border forms the spinoglenoid notch. The spinoscapula has got an upper lip, lower lip and intermediate area. The upper lip of the spinoscapula gives insertion to a muscle called trapezius. Trapezius muscle is inserted onto the upper lip of crestospine, while the lower lip of crestospinoscapula gives origin to posterior fibers of deltoid muscle. Spinoscapula laterally it continues as the acromion process. So here we have the acromion process. This acromion process is subcutaneous. It has got two borders. There is a medial border and lateral border. Medial border continues as the upper lip of spinoscapula and the lateral border continues as the lower lip of spine of scapula. And it has got a tip. Two surfaces, superior surface and below we have inferior surface. Lateral border of the acromion process, you can see some tuber projections are there. Okay, these projections gives origin to the multipinnate fibers of deltoid muscle. So here you can see the coracoid process very clearly. Okay, this area, tip of the coracoid process gives origin to short head of biceps and coracobrachialis. And its medial, it has got a medial border. So the medial border, the pectoralis minor muscle is censored onto the medial border. And we have connecting the coracoid and acromial process, we have coracoacromial arch. And the superior surface of the coracoid process gives attachment to trapezoid part of coracoclavicular ligament. We have an facet for the clavicle. The lateral end of the clavicle is articulated to form the acromioclavicular joint.